Bursting with life, Leah died because of one bad decision, but also from what's been described today as a national problem hidden in plain sight. The first Leah's mum realised it was when medics were trying to resuscitate her daughter.
I knew as soon as I got there was police, there was other nurses around, and I knew just by their reaction it wasn't good. They had their heads down.
Leah had overdosed on MDMA whilst out with friends. She lived here in North Allerton, Rishi Sunak's constituency, which doesn't look like it has a youth drug problem, but does, and it's often children who are selling the drugs. Tammy's teenage son supplied the MDMA that killed Leah. She doesn't want us to give his name, but he got sucked into county lines dealing from the age of 14, and Tammy says for 3 years she couldn't get support to get him out.
3 days before Leah died, the police were in my house. I was asking for help. And if something would have happened those 3 days, or when he was 14, he should not have gone to jail, and Leah would be here.
This is exactly the problem identified by today's report from the Commission on Young Lives.
One of the things we got told time and time again was that, when a parent found the horrific burner phone in a child's bedroom, or a knife, or some cash, they'd ring up social services or they'd ring up the police, but no one could help them.
Leah's mum thinks people who deal to teenagers should get tougher sentences, but recognises the boy who supplied Leah's drugs was himself exploited.
He was groomed. He was groomed to do this. I don't think he's a horrible person.
Do you think he's a victim?
Yeah, 100%.
A report by the Commission on Young Lives today recommended a sure start for teenagers, bringing support and intervention together in local hubs, backed up by what it calls an army of youth workers, and schools remaining open during school holidays and weekends as safe places for children, along with an additional £1 billion investment to combat teenage mental health problems, with money raised from social media companies.
It used to be the case you'd have 11, 12, 13-year-olds who were delivering the drugs. Now that's going down 9, 10, 11. But also where you've got young teenagers, 13, 14, actually heading up county lines, delivering drugs across the country, running a business here in a very ruthless way.
Previously, we've met gangs running county lines, looking to exploit children.
This is what I give to the people and the little kids. They all go out for me.
And the report says with the cost of living crisis, more children are easy prey. Research by the YMCA published earlier this year found across the country the annual spend on child services has fallen by 74% in the last decade. And what this report is calling for is more investment. Be it in the inner cities or the Yorkshire countryside, reversing those trends won't be easy.
It's not just about let's throw this money here. It's about how we're going to do it, who's going to be trained on it, and where are they going to get the social workers and the youth workers, because nobody wants to come into health and social care at the minute.
The report argues that investing in preventing children from being exploited in the long term would save huge costs within the criminal justice system, as well as preventing heartache for families. Jason Farrell, Sky News.